What's the difference between someone taking the NCLEX and getting about 85 questions versus someone taking the NCLEX and getting 150 questions? In this video, that's exactly what I'm going to explain with you and show you exactly what you need to know. Now, before you start watching this video, one thing I would recommend, especially if you are in nursing school right now and you're struggling to learn the content, or you just want to make sure that you pass your nursing classes, I would highly recommend that you check out Picmonic. Picmonic is a great website that provides very highly visual, educational, simplified nursing and medical content that will teach you how to better understand the material, how to retain it in a way that's easier for you to understand. If you click below this video, you check out the description, you can get started right now for free. Okay, so now let's get right into it and let's talk about what essentially is the biggest difference between 85 questions versus 150 questions, and exactly what you need to know, how you should prepare, and what you should expect. Now, this video hinges off of one of my last videos that I talked about a few years back, where I talked about 75 questions versus 145 questions, which is what the minimum and maximum passing standard was back then. And today now, I'm talking now what the minimum and maximum passing standard is today. So first let's talk about what it means if you got if you're taking the test and you got the minimum of 85 questions on the exam. Okay, so if you got 85 questions, so let's talk about what that means essentially. So 85 questions. Now, what I will tell you is that if you haven't got your results yet, you won't truly know how you did as far as your results until you get it in the mail, right? Or until you see your license. And so the thing about it is that if you take the test and you get 85 questions, it means that you did either very good or you did very bad. It's usually not in the middle, it's only one or the other, right? So here's the thing that you have to see, it is that when it comes to the NCLEX, there's what you call a minimum competency, right? So there's a minimum passing line. And what that minimum passing line is essentially saying is that, okay, in order to pass this person, they have to get a certain number of questions above the minimum passing curve, right, in order to pass the test. And so when you're taking the test and you're going through the exam, you're going to get these series of questions. And many times at the beginning of the test, the questions at the beginning aren't as difficult, right? The questions at the beginning, they're not as challenging because usually the easiest towards the beginning. But as you're taking the test and as you go through the questions definitely get more and more difficult. And so essentially, if the exam gets to 85 questions, which is the minimum passing, right? The minimum number of questions you can get, and you take the test and you get that number of questions, then it either shows that essentially the test is saying, okay, this person has demonstrated either one, they know more than enough information to pass them, right? So they know the minimum amount to pass where we don't have to keep giving them questions. So for example, let's say, just to make things very simple, we're looking at simple math, right? So let's say I'm trying to see how well you know very basic math. And so I ask you, what's 2 plus 2? 4. What's 4 plus 4? 8, right? And so I just spit all these questions and you pretty much get almost every single one of them right. Well, at that point, you have demonstrated to me that you pretty much know basic math. And so I don't have to keep asking you more questions because you show that, right? I don't need to ask an additional 50 questions or 60 questions to see, right? Now, so that would be an example. That shows that you have demonstrated that you know the majority of the questions right, and so we can trust your nursing judgment. Now, let's say you take it and you don't pass, right? You failed the test. So then that shows that you were doing very poorly, because then it means that you were probably doing very poorly with the questions from the beginning all the way until the 85, right? So, and you weren't showing enough basic competency during the beginning all the way towards the 85 question mark. So showing the same example I just said right now, It would be, for example, if someone was asking you the same questions and I said, okay, what's 2 plus 2? And you said 5. What's 4 plus 4? And you said 10, right? At this point, this person does not know, basic math, right? Let's stop asking the questions, and they need to be re-educated. Same thing with the NCLEX as well. It shows that there's a lot that you really don't realize that you don't know, and so at that point the test is going to stop. Now, let's say now you get the maximum questions. You get 150 questions on the test. So what I would tell you is that it can either be good or bad. It doesn't really, you don't really know until you find out your results. And the reason why is because essentially there's something called like the 95% confidence rule on the NCLEX, where it needs to determine with 95% confidence that you are, competent to have a nursing license. And essentially what's going to happen is that it's going to keep asking you questions, and it's going to ask those questions, and it's pretty much, it got to that 85 question mark, and it's determined, okay, this person, they got some of these questions right and they got some of them wrong. So we need to keep asking them more questions to be certain whether they are failing or whether they are more on the correct side, right? So that's essentially the same thing with when you get the full number of questions. The test was trying to determine if you really do understand the content. And many times this is why you have a lot of test takers that will come back with the results, and if they didn't pass, then the result will show near passing, near passing, near passing, near passing, right? So they were very close, but not quite there, right? And so what should you do in this case? So if you take the test and you get your results and you don't pass and you get 85 questions, then you need to focus on content review, all right? Content is going to be your biggest thing, and generally what I've seen from most students is that they usually have at least 2 or more below passing areas. If you took the test and you got 150 questions and you did not pass, then that's a sign that you probably need to honestly brush up on more strategies, more critical thinking, and a little bit more content review in the areas that you got below passing in or near passing in, right? So these are some of the tweaks that you need to make. Not as many tweaks and changes if you got 150 questions as opposed to for those that got 85 questions. 85 questions, you're gonna have to put in a lot more work, and you're probably gonna need at least, maybe depending on how much time you spend per week to study, about 1, 2, or 3 months of studying before you take the test again. But 150 questions, don't waste too much time. I would recommend 45 days, more or less, and focus on those strategies. Don't completely change what you did the last time. Do what you did before, but more, and then take your test again. If you find this helpful, if you learned something from this, I want you to comment below and tell me right now, did you get 85 questions or did you get 150 questions? I would love to hear from you and find out where you're at right now when it comes to this exam. And if you are in a place where you feel like you're really struggling and you really want some type of support system to help you to pass your exam, to help you to get to the next level, then I want to invite you to join my membership academy. My membership academy is essentially a place where you get access to my videos, modules, and trainings where I can teach you and show you exactly how to pass the NCLEX. This is something where you can learn the step-by-step pattern in order to become a successful nurse, as well as also to pass your boards, learn nursing content, and so much more. This also includes a private community, as long with also coaching, where we meet live, usually through like a private community, and where I can provide more teaching as well as practice questions to help you to better prepare for your exams and for nursing, right? So if you want to be a part of this, go ahead and click below this video to check out in the description to learn more about the program. All right, so thank you for tuning in. Go ahead and hit the like, follow, and subscribe button, and I'll see you the next time.